Next in Better Health, we visit the maternity department to see how their new maternity program is faring.
Today we're going to talk about the Maternity Quality and Safety Program in Southern DHB. This is a national initiative rolled out by the Minister of Health. It involves all the district health boards having the program, both in the Dunedin site and the Invercargill hospital sites, but also clinical governance structures over both sites and throughout the DHB.
It's really about the women and the consumers, and also the primary providers, the LMCs. But also where the doctors fit in is very important.
So the program has a clinical governance structure which has representation by midwives,
the junior doctors, the consultants,
managers from rural units,
the LMCs, of course,
obstetricians,
and the women, of course. The project has been going for about 2 or 3 years now, and we've seen it from the ground up, and it's very exciting to see how it's come together, because it's a unique and new thing for New Zealand, in that it allows the LMCs and the core midwives and the doctors all to work together, and the consumers as a team, to look at outcomes, to be proactive about outcomes, and to help the maternity quality.
So an important part of the program is consumer involvement, and because of the large area that we have in Southern DHB, a large geographical area, we thought it was really difficult to have a woman or 2 women representing all of the areas of the District Health Board. So we've gone to develop community and consumer groups throughout the region. So we have one established in the Waitaki, one in Central Lakes District, one in Invercargill and one in Dunedin. So in those groups, the coordinator for the program, Nicola Keast, and myself and other representatives of the program go out and meet with consumers and community providers.
It does give them a voice into the structure that is supporting them, but also it allows them, I think, to see some of the quality improvements that are happening and to get some feedback on that.
So that gives us a forum to discuss local issues, for us to talk about the program, because one of the expectations is that we have consumer engagement. So we talk to consumers about what's going on in maternity, what the program can do for them, and what they can do for us, actually, because they give us wonderful feedback, absolutely wonderful feedback.
And that's important. I mean, when it comes to quality, transparency is important. It engenders confidence and trust, and we're all part of it together, so we're a team.
The program's very prescriptive. So the Ministry have set up a National Maternity Monitoring Group. They will write letters and say, this is what we're interested in, please report back on this. We have to do an annual report on the program every year, and they send out guidance and say, we will be expecting to see in the report this, this and this. So it's really quite clear, and in that way there's a bit of national consistency about what's going on, which is really valuable. One of the areas they do want to look at is variations in practice. So that means that we have to look at ourselves about what we're doing in Southern in comparison to what's going on for women getting maternity care in other parts of the country. So that's valuable for us.
From the consumer's point of view, it allows, first of all, for them to have access to the secondary care consultants and also the administrators, and also the people at the top, like Jenny Humphreys, and to give some input. And then we are bringing to them some of the outcomes.
And we've had some interesting findings, things like more women smoke at 2 weeks after they've had their babies than when they had their babies. So, we're doing really well and giving a lot of support around women in pregnancy to stop smoking, which is really important health initiative.
I mean, our district is so big, and it can be difficult, but to have a physical presence, but that's also important. To get around and meet people.
Southern District Health Board are really fortunate that we have primary maternity units scattered right throughout our areas. So we have the 2 main hospitals in Invercargill and Dunedin, but we also have primary maternity units in Oamaru, Alexandra, Queenstown, Frankton, Queenstown, Lumsden, Gore, Tuatapere, Winton. So our women are very well served by primary maternity units.
The best part about my role is the numbers and the data.
Being able to go out and talk to women.
I like the statistics part, and you know, seeing how we're doing.
And actually being face to face with women, talking about maternity care, with a sort of an emphasis on where they are, but building into the bigger picture of the whole district health board is hugely valuable.
I mean, it's a great thing for New Zealand because it just really brings the midwives and the obstetricians close together for something that they both care about.